All right, I am really excited to be here. I've been trying to decide all morning if I'm experiencing positive, tolerable, or toxic stress in relation to this presentation. I think I've waffled between all of them this morning with some cortisol in the mix. But I'm really excited to be here. Like Susie said, and this is something that I'm really passionate about. I think any of us that kind of catch the spirit of the importance of this movement, it's really hard to sit and do nothing. And so to be here and to hear from other people who are doing wonderful things in the state and to be able to talk about in a few minutes about some of the things that we can now do from this point on is just a great opportunity and really fulfilling to me personally, as this is an issue that I'm really passionate about. So as Susie said, I started an organization called the Trauma Informed Care Network of Utah, and I'll kind of tell you the story of how that happened. So just to kind of put it in the context of what we're talking about today, so we've had these great presentations to understand the impact of trauma, and some of us might have come here today with a lot of knowledge on that topic, some of us limited, and maybe there's some of us here who really didn't get how important this issue is. And I think each of us, as we reach that level of awareness, that's part of our healing process, both individually and as a community. When we get that aha moment and say, wow, this stuff is really important, we're already on a better pathway to healing. So we know about this now. What do? We've heard a lot of things that people in our state are doing, and that's really exciting. And I asked myself that same question. I actually met Vincent Fletty at the EMDR conference just a year ago, heard him speak, heard the ACEs information, and then felt very inspired in that moment as I'd been already kind of thinking about this being a trauma therapist. This stuff is really important. How do we get the word out? And then I read or listened to his ACEs presentation, and as many of us here realize, wow, this is the information that we need to get to people. This kind of tells that story. So coming back to Utah, and after talking to Vincent Fletty, one thing that struck me, he told me a few things when I talked to him. He said, Kristan, I was in a comfortable practice. I could have easily coasted on to retirement, but I found out this information and I had to research it. And you can see what he's done for the next 20 years since he initiated this study. It's still having this growing impact. It's taking time. I was talking to a colleague from DCFS, and she described it, this tsunami that's coming now, that this movement is really growing, that he and many others started years ago, that we're finally reaching this critical mass. So again, I asked myself this question: how do we identify clients with trauma? How do we refer them to appropriate treatment? That's something that's been brought up today. We ask the questions, we screen. How do we get these people to treatment? How do we find practitioners who are trained to understand trauma and then trained to help heal and resolve trauma? And how do we find these people? And this is a question, as I've talked to medical people in the community, that they've said, I know one or two trauma therapists that I can refer to, or organizations, but I always kind of go to the same person. I'd love to know where these trauma-trained therapists are. And I've also had therapists ask me the same question about medical people. How do I find doctors who understand this? Where do I send my clients so that they don't get marginalized or misunderstood, or just have the symptoms treated? How do I find a medical person who understands what's going on underneath the surface? So again, these were the questions that we were asking. Just to tell you a little bit more about myself, as Susie said, I was a school psychologist, so I worked in the public ed domain for 13 years. I taught in the school psych department at BYU. I always wanted to move towards a more in-depth therapy setting. In public schools, we get to do a lot of behavioral type things, but we don't always get to sit down for an hour with someone and to hear their story. Often we're just kind of focused on intervention. So that was something that I worked towards and got licensure to do private practice in 2008. And then have the opportunity at that same time to train in a trauma resolution technique. And that is what really started opening my eyes to this issue. In those trainings, learning about trauma and learning about the impact that it has on people. and recognizing the pervasive impact of big T and little t trauma. And we haven't talked too much about those terms today. I just wanted to highlight that a little bit. The big T traumas are kind of these obvious ones, maybe the DSM-5 diagnoses, you know, you're in danger, or you observe someone in danger, you're in a natural disaster, but to also really acknowledge these little t traumas. Someone talked about humiliation and bullying, kind of inadvertent things that can often happen in the home when parents aren't aware that they're traumatizing a child, or they've neglected some important moment or some incident that happens to a child. And we see this all the time as therapists, that someone has the same physiological reactions that they would with one of these big T traumas, and we trace it back, and it's what the 4th grade teacher said to them in a humiliating moment or something like that. So that's really important to recognize that we can't always predict what's going to traumatize people. And then in doing this training, you know, I probably would have been a really mediocre therapist if I hadn't got this training. And as someone said, I can't remember who it was, it does increase our job satisfaction, or whatever that word was that you used. When we get trained in these modalities, they have research that shows that trauma-trained therapists have a much lower burnout rate, much more optimism, that this is something that's actually really exciting and energizing for therapists who see these amazing results when we have evidence-based treatments that actually kind of understand this neurological thing that's going on and can help, you know, do this brain change that we've talked about, to see the huge impact that that has on people emotionally, socially, relationships, and health issues. I've had clients whose health symptoms subside as we do their deep trauma work, and that is really exciting to see. To talk about some of these treatments that we've touched on, there are great evidence-based modalities that we can use. I have a colleague in the community who's kind of old school and made the statement just a couple months ago, you can't heal PTSD, and that is a message that we need to talk against. Certainly we've talked in here about some of those long-lasting impacts on the brain, and that maybe we can't get that person to 100% of what they would have been had they not been through those traumatic experiences, but we can certainly get them along the way. And then, as you know, the last speaker talked about post-traumatic growth, that there are some positive outcomes that can come to people, and there's a growing body of research on this, that there might be some positive benefits or things that they can have in their life having gone through those experiences and then resolve their trauma. So we need people to know that we can definitely help people heal trauma and help them make a lot of progress. We know about neuroplasticity, the brain can change. We can change physiological and neurological factors. So these are some. The APA cover story in 2008 talked about, we've heard today, prolonged exposure therapy, cognitive processing therapy, stress inoculation training, EMDR, which has been mentioned several times, and some medications that can help along the way with that process to help stabilize someone. And then again, the VA, like we just heard from Steve Allen, their kind of top ones that they've reported is cognitive processing therapy, prolonged exposure therapy, EMDR, and medication. I had a client sitting in my office that came to see me for the first time probably 3 months ago with some more of this kind of subtle little t trauma that she hadn't, well, I'll let you listen to her talk, but as I was listening to her talk, we had done, you know, several weeks of trauma therapy, and she just came in, you know, after one of our big sessions just glowing about these results, and she elucidated this really powerfully, and as I was listening to her talk, I said, can you record that to me? She just happens to be a media productions professional, and I said, can you go home and do me a 3-minute, I actually said a 30-second snippet, but she heard 3 minutes, so you get to hear her for 3 minutes, so we'll listen to that.
My name is Melissa. I'm 26 years old, and 6 years ago I was diagnosed with PTSD. From a very young age, as long as I can remember, life was hard. I tried to get help. My parents wanted to help me, and so I tried every type of medication there was. I went to doctors and therapists and counselors, but I always felt the same. Coming back from college, I decided to visit one of my old counselors. In a short visit, he asked me a simple question I had never been asked before. Did I have a history of abuse? I think that was the turning point because I had never asked myself that question. Growing up, I never thought of myself as a victim. I thought that's the way everybody lived. You know, the situations I was in and the things I experienced, I thought were normal. And that's really when the lines of communications opened up and an honest conversation about my life was able to take place. Right after that visit, he passed away, so I was not able to start my treatment then. So a few months ago, I decided it was time to try to work through these problems. Starting to work through everything can be intimidating, but there is this power of processing the trauma and the triggers. In less than 2 months, I went from living in constant anxiety and real physical pain to releasing all of that. I don't even know how to explain it except it's gone. I had been living in survival mode my entire life. I was wrong to think I had to live with that pain that I had been put through. It was really unfair that every aspect of my life was still controlled through these things I had no control over. And I feel like for the first time in my life, I am the person I was meant to be. And there can be real healing to break the cycle. We're not meant to live like this, and we don't have to. I share my story with the hope that others can see the reality, and most importantly, that EMDR works.
So I think that illustrated better than I could that powerful impact that good, research-based effective trauma treatment can do for clients, and to see the great impact that that has on their lives. Just to talk about EMDR for a second, that's the modality that I've been trained in and the one that I know best. It is evidence-based with more than 20 positive controlled outcome studies. Single trauma victims, 84 to 90% of them after 3 sessions can have no PTSD symptoms after that. And I've seen that over and over again, that those big T one event traumas, that we can really knock those out pretty quick sometimes. 100% of single trauma victims and 77% of multiple trauma victims were no longer diagnosed with PTSD after only 6 50-minute sessions. And 77% of combat veterans were free of PTSD in 12 sessions. And certainly we don't always get this clear cut of results, especially with complex trauma when you're dealing through a lot of layers of trauma from different ages and different types of trauma. But these are some of the positive results you can get from these evidence-based techniques. And again, EMDR is now recognized by the APA. The World Health Organization just recognized it. It's used all over the world after natural disasters and war zones, things like that, and the Department of Defense has also recognized that. So realizing this and seeing the great impact that we can have on clients, I realized that we needed to collaborate. And again, I heard Vincent Fletty speak last year and was motivated to start a therapy clinic. I was a solo practice and thought, oh my gosh, there's all this trauma, I can't handle it all by myself, so I got some more people to help me. And I thought, but we can't even do it, just my little group. We got to get all the other therapists on board so that we can all work together. And so that's the birth of TICNU. And the idea behind that is that we formed an organization to educate just the community at large, all the different people that are here and represented, and then specifically mental health providers and medical professionals about the impact of trauma and effective trauma treatment. I was actually in this room about 1.5 years ago, probably sitting right over there having lunch and talking to about 6 therapists, and a therapist in the room here said, Kristan, tell me about trauma, what is this? And I think we need to know about this, don't we? And going around that N of 6, sitting there at the lunch table, I was the only person who was trauma trained for sure, and that trauma-informed thing was just kind of, some people had a little more information on trauma than others. So even in the mental health profession, where you think that we should have quite a bit of training in that, there's a big lack, and I would say that maybe 20% of us are trauma-trained, maybe 30% of us are trauma-informed. Those are very rough, numbers from my own experience. But in our field, it's really important for us to become more trauma-informed. So we want to increase this awareness, and I've found in my practice that when I can team with medical professionals who understand trauma, and that I can send my clients to them and they can send their patients to me, that we have this really effective loop. So I have that set up in my own practice, but I would love to help create that for more of you, whether you're a medical person or a mental health person, that we can make those connections so we know where to send people to when we identify these issues. We've talked a lot about trauma-informed care, so we don't need to spend too much time on this, but I love the question that's been said before. Rather than asking what's wrong with you, we need to ask what happened to you. Some of the obstacles, as I've discussed this with other people, why has this been hard to get going and to move forward? First of all is awareness, and that's something we're doing, trying to address today. And then we've heard several times today that practitioners are scared to ask, scared to stir up trauma, not sure to handle it if it comes up. And then, as we know, a big percentage of us as practitioners have our own trauma. And if we haven't dealt with that, that can be hard and triggering for us to bring that up and discuss that with our patients and clients. And then the last thing, just not knowing how to handle it once we identify it. And this quote, I think echoes what's been said today. In my training as a family, and this is a man who has really made a lot of inroads, I think, in the Compton community with the ACEs information, or somewhere down there by Compton. In my training as a family physician, I was told not to pull up the lid on something you don't have the time and training to deal with, like early life trauma. I'm deeply embarrassed in looking back at my career caring for patients because I followed this advice too often. It's likely that many of my patients had early life trauma that was probably sitting right below the surface, but I rarely asked. It's frightening to open up a Pandora's box in a 10 to 15 minute visit of an overwhelmed primary care office. And actually, I should read that last part. I believe the ACEs score should become a vital sign as important as height, weight, and blood pressure. So what we offer, just to tell you a little bit about our organization, it's very fledgling. We just started in January, so we're still trying to find our place in this whole movement. And I'm definitely open to your input, ideas you have, maybe things that already exist similarly to what we're doing. But, we shouldn't be doing this alone. We should team together and make these things happen. So we have monthly meetings that anyone from the community and, again, mental health and medical practitioners are invited to. The second Friday of every month. And if you're interested in that, you can go to www.ticn.org to learn more about that. My email is at the end of this presentation. You can get on our email list if you want to be part of that monthly meeting. We do have this website, and again, this is all kind of out of pocket, so I have a volunteer helping me with the website, and it's still in kind of its rudimentary stages, but talks about trauma-informed care, and we're trying to compile lists of trauma-informed mental health providers and trauma-trained mental health providers and trauma-informed medical providers so that when I need to find a medical person, I can get on this list. And again, that's feedback that I've gotten from many people that we need. And then a list of trauma-related resources that link to SAMHSA and things like that. Some ideas that we've tossed around. Arizona has a trauma crisis response team, and we're looking into possibly coming up with that with some trauma-trained therapists that could respond to emergencies in the community or disasters. We're thinking about ideas around doing trauma-informed training for medical providers. There's some great things being done with that in the schools, but maybe some of the people out in the community who might not have as much access to that we could then kind of certify them as trauma-informed medical providers. promote more trauma screening, which I think we're all trying to work on. And another piece that's important to me is to have each of us understand simple grounding techniques for clients. I think if we weren't scared to ask, because we know that we can, if someone gets triggered or starts dissociating, there's some really simple ways we can do this. You can Google PTSD grounding techniques, and they're as simple as, I'll just do it for 30 seconds right now. Feel the pressure of the feet, or the ground on your feet. Feel the chair on the back of your legs. Listen to the sounds in the room. What do you hear in the room? Focus on something. What do you see visually? And that simple exercise alone, I've never had a client in my office that we can't get grounded and centered again. So I think if we can spread those techniques out to people who are asking these questions and having these conversations, that we won't be as scared to ask. Just a couple needs, and again, I'm totally open to feedback and people participating in this organization. We have, like I said, a very rudimentary website, so if anyone has access to resources around that, we'd love to expand our directory, or if there's other directories out there, we'd like to merge with those directories and get the word out so people know where these directories are to find trauma-trained medical and mental health people. Again, expand therapist connections with the medical community. I think we're both doing great things, but how do we get to know each other? How do we learn to speak each other's language? How do we maybe not be intimidated? I've had therapists say, medical people are intimidating, but I've also had medical people say, you therapists are kind of intimidating too. So how can we build those connections? Because we really need to work together. And then any sources of funding to help with this movement, and again, any ideas you have as you're listening to this to see where this organization can help meet the needs of the community. So I really look forward to working with all of you. This is such a great thing that's happening here, and I'm encouraged about what's happening in Utah, so thank you. That is a good question. So when you look at he asked what is EMDR? And so it's a movement, when we're talking about all this neurological stuff that's going on with trauma, talk therapy doesn't quite cut it. We have to do something that gets into the cerebral cortex. And so the idea behind EMDR, it was developed about 25 years ago, is that using bilateral stimulation, whether that's eye movement, tactile, auditory, that kind of helps the brain get into a more integrated wavelength or frequency so that we can start integrating disintegrated information. So this trauma is stuck over there, and that one's stuck over there, and this negative message and that negative emotion. And there's a lot of scientific research coming out now. When it first was created, they didn't know why it worked, but now they do. And that it helps the brain kind of heal itself through that neurological process. So go ahead.
Do you have any grounding techniques when you're on the phone?
That is a really good question. I would guess you could do the same exercise, just that simple thing, and even, anything that's kind of meditative. For some people, deep breathing can work. If someone's kind of hyperventilating, that might not work so well. But that same getting in contact with the five senses, what do you see, what do you hear, what do you feel, what do you smell, and that literally gets someone grounded back to the present rather than caught up in what happened, in Afghanistan or what happened when they were 7 years old, kind of pulling them back to the present. So, any other questions?
I think we'll call for questions, but I'm sure that Kristan will be available for additional questions during the break time. And one point I just would like to emphasize that Kristan started touching upon is with Felita's data, he clearly states, just by asking that question, in the primary care setting, the school setting, whatever setting it is, it could be with your neighbor next door, what happened or did something happen? Help me to understand. That one question has such a significant impact for overall outcomes. And it doesn't mean when you ask that question that every single one of these people need to be in significant trauma therapy, but it starts turning that wheel that they are validated, that they're recognized, and that allows that healing process to begin. And there are so many resources out there that people can start to heal themselves and then if they need additional services, find really expert therapists who are trauma-informed to help really reduce that very significant burden. But that one question alone I find so striking that can have such a major impact.
I think he said that it reduced doctor's office visits by 35% and emergency room visits by 11%. So just asking that question. Just to close, this is our information both for my therapy practice, which is a trauma-informed, trauma-trained practice, and for our website. So if you need to contact me, that's the information. So thank you.